welcome to the information session for the Respiratory Care Program found here at Lone Star College-Kingwood. My name is Dr. Fiona Campbell. I am a respiratory therapist and program director of the program. In this session, we will talk about an overview of the profession, as well as applying to and being accepted to our program. As respiratory therapists, we practice in the profession of respiratory care. The video I am about to play is a short video on an overview and the best parts of being a respiratory therapist, and I will expand a little bit more once we've played it.
I'm a respiratory therapist.
I am a respiratory therapist.
I'm a respiratory therapist, and I save lives.
A respiratory therapist is a professional who has been trained to work with patients who are affected with chronic lung disease across the spectrum.
So anything that affects your breathing, a respiratory therapist is likely going to be involved in the care of that patient.
A respiratory therapist is not only a therapist, but a practitioner. We help patients in so many different capacities, not only with breathing, but with education, with lifestyle. So we have many different roles throughout healthcare. It can involve working in a hospital such as the ICU, a neonatal ICU. We can work in the emergency department. We can work in diagnostics and therapeutics. We do outpatient education. We do smoking cessation, asthma education. We work in pediatrics. So, a respiratory therapist, we hold so many different roles that really help the community in so many different ways.
I'm a respiratory therapist.
I'm a respiratory therapist, and I care for my patients breath by breath.
The thing I like most about it is the variety of the day and the variety of the career. In the hospital I'm at, we have neonates all the way up to adults. We have a burn ICU, trauma ICU, so we can be anywhere at any time of the day.
There is always a patient that needs something unique. Sometimes there are physicians that have different needs that we have to take care of.
Obviously, it starts off finding out where I'm at, where I'm assigned to, getting a report from the night shift, seeing what the plan is for the patients, and then going to see every patient, doing rounds.
I work in pediatrics, so I may get 5 patients, may get 6 patients, but they're patients that need help with breathing, and my job is to provide them with their treatments. A typical day would be going from giving a treatment to maybe a 5 or 6-year-old that's slightly sick, then going into an intensive care unit, somebody that's much more ill, and every decision that I make on how to set that life support machine could affect their outcome.
We have so many different pieces of equipment, and they all do so many different things, from a wide variety of life support equipment to sustaining equipment to equipment that just will deliver oxygen.
So a typical day is checking equipment, getting with our people. We also will go in-house and check on the therapists in-house and see if they need anything. But primarily, we're waiting for calls, and they come. We usually do 2 to 4 transports a night, and they can be anywhere from 2 or 3 hours long to 6 hours long, or sometimes even beyond the shift.
We see each patient anywhere from 1 time a day to 6 times a day, depending on the type of patient.
Day will typically end right about 5, 6 o'clock in the evening, so about 12-hour days. I'm a respiratory therapist.
I'm a respiratory therapist, and I love taking care of people.
I worked in a teaching hospital, so it was routine that we always had students, following us. Precepting students was one of our responsibilities. So that's how I got into education. I became a clinical instructor. That also opened another door for me when a program director position became available.
Empowering the patient to manage their chronic lung disease so that they understand that they can live a good life. It's about quality of life, so I feel that if I can help teach them on how to handle their chronic lung disease. It's about having the confidence that they're going to be okay.
The education and dealing with the patients, it's very satisfying to me. You go in a room with someone you haven't seen in a while, but they look at you, the family looks at you, and they remember you, and they're happy to see you, and that makes my day. It makes it all worth it. So, I'm a respiratory therapist.
I'm a respiratory therapist.
I'm a respiratory therapist, and I make a difference.
As a respiratory therapist, we are considered frontline essential healthcare workers. We are the therapist practitioners that primarily have the responsibility of initiating, managing, and discontinuing ventilators, and which are the life support breathing machines. Here in the greater Houston-Galveston area, the annual salary is approximately $60,000 or more per year. We have an extremely viable job market. There is actually essentially a shortage in our area. There are many positions available, both within the Texas Medical Center as well as in the outlying surrounding Houston-Galveston areas. Most of our graduates, almost all of our graduates, will find positions that are full-time with benefits and enjoy a lucrative career. The Respiratory Care Program has been in place since 1984 on the Kingwood campus, and the Respiratory Care Program prepares graduates for credentialing exams from the National Board for Respiratory Care, also known as the NBRC. Our program is accredited by COARC, which is the Commission on Accreditation for Respiratory Care. We are fully accredited and in a very good position to continue providing the education needed. Our program is structured as an Associate Degree of Applied Sciences program, in which it is delivered in 66 credit hours over 6 continuous semesters. That does include summer semesters. We are considered a full-time curriculum. For those that have concerns in the number of credit hours per semester, the program does offer a minimum of 6 credit hours per semester. Our program is cohort-based, where there is a day cohort as well as an evening cohort. When you are in a cohort, the cohort remains either on the day track or the evening track. Students will complete their clinical or practicum courses in 8, 10, or 12-hour shifts. This is to help with progression as well as mimic the workforce that is experienced as a respiratory therapist. Clinical practice is conducted at local hospitals, in which the hospitals do range from as far north as Conroe, as far west as Texas Children's Hospital and Methodist West, as far east as Methodist in Baytown, and as far south as the Texas Medical Center, as well as Women's Hospital of Texas. There are 2 application periods for the program. The first is for a spring program start. This is our evening program. It is the first business day in June to the last business day in August every year. For those interested in the day cohort, that is the summer program start, and the application period for that is the first business day in November to the last business day in January. To become an applicant for the Respiratory Care Program, first you must be a Lone Star College student or part of the Lone Star College system. If you need to apply, you can certainly find the link here in order to apply to the college itself. Once you are a Lone Star College student or already part of the Lone Star College system, Please ensure that all outside transcripts, official transcripts, have been submitted to Student Services. After submitting all transcripts, they will be generated in your profile, and then you will go to our health occupations based application found at this link. In this application, your information found within the Lone Star College system profile will auto-generate your application. Part of that application there are a few more requirements for your application to be considered complete, and I will discuss that in a little bit. If you have any issues in the application process, please feel free to contact the Respiratory Care Department, where we will be more than happy to help with that process. Prerequisite courses that must be met in order to apply to the program are Biology 2401, which is Anatomy 1, English 1301, which is Comp and Rhetoric 1, and Psychology 2301, or General Psychology. For the math requirement, there really is not a math requirement. We just need to ensure that an applicant is college ready. One thing that I do need to emphasize is that courses must be completed with a grade of C or higher reflected on the transcript before you're eligible to apply to the program. The other general education co-requisite courses, these are not mandated to be on the transcript to apply, but they certainly are helpful in the scoring system. Additionally, these must be completed before the degree is awarded, so having these ahead of time will always help an applicant. The courses are Biology 2402, or Anatomy and Physiology 2, Biology 2420, or Medical Microbiology, and your elective of a Fine Arts or Humanities course. Another requirement of the application process is the entrance exam. The program utilizes the Health Sciences Reasoning Test, also known as the HSRT exam. The HSRT exam consists of 33 questions that assess reading comprehension and critical thinking skills. For this program, each correct answer is awarded 1 point towards the total overall application scoring. The registration process, the exam is available from the first day of the application period until approximately 2 days before the application deadline. As an applicant, you will pay for the test using this QR code, or on the department website you can find links to the payment code. The payment is $15, and please ensure that you are registering for the respiratory care entrance exam. Once you have paid for the exam, you will schedule for the on-campus administration. It is an online exam, but the online exam is administered in a proctored setting on the Kingwood campus. Once the exam is taken, the score is input into the academic profile. Please be patient, as it may take up to 2 days for the score to populate into the application. Scores are only accepted for the current application year. The scores are not taken from previous years of application. Once again, to ensure that the application is complete, you can always check your application at this website, in the Health Occupations website, during the application period. Ensure that these two requirements, the HSRT exam and a writing sample, are input onto the application. The writing sample is uploaded into the application website itself. The prompt for the writing sample is to write a 1 to 2 page paper on the specialty area of respiratory care that interests you, and conclude with a paragraph explaining why you want to enter the program. This essay should be in MLA or APA format and must be typed and uploaded to the application. Once the HSRT exam has been completed and the writing sample is uploaded to the application is considered complete and submitted. Once the application is completed, it will be entered into the application pool, and once the application period has ended, a selection committee will meet and select the top 24 applicants. Part of the selection process is to review the score sheet submitted with the application, the scoring of all academic courses applying to the degree plan on a numeric scale, completion of any previous degrees, the HSRT score submitted, writing sample, and the points deducted for retaking of academic courses. As of right now, the admission to the program is limited to 24 students. I do say it is to be determined for spring 2023 and beyond, as we are assessing the growth of the program. The overall application scoring is based on 4 general areas. First is the prerequisite GPA must be met at a minimum of 2.0 GPA cumulative. The section 2 is the grade points earned for each of the general education courses taken. Section 3 is for any educational degrees earned outside of respiratory care, so this will include certificates, other associate degrees, bachelor's degrees, even master's degrees. Section 4 is the HSRT exam, in which, again, 33 questions, 33 points are awarded, 1 for each correct answer. A common question is repeated courses. As with other healthcare programs, this is a competitive program, and students and applicants tend to retake courses to ensure the highest GPA and highest scores possible. If you do take a course to improve your GPA, the application will accept the highest grade into the GPA and the overall scoring computation, and each time the course is taken, 1 point will be taken from the total score. For example, if a course earns 12 points, but it was taken twice, 11 points will be awarded. Once an applicant is selected as a potential respiratory care student, admission is conditional upon a background check and drug screening. The Lone Star policy states that a student who is accepted and completes the degree, Lone Star is not responsible if other agencies find on the background check an issue that may prevent licensure or employment. If you have a concern regarding your background check, please feel free to reach out to the department and we can discuss how to navigate a finding on the background check. Likely you will be referred for the Texas Medical Board Respiratory Care Practitioner licensing. We want to ensure that anyone that has something on their background check is able to gain their license after graduation. I have the information posted here in case someone wanted to ask questions or inquire about possible background check issues. And the best thing to do as a student is to obtain confirmation that license can be obtained after graduation and based on that background concern. Once a background check and drug testing has been completed, there are documents and immunizations and health requirements that are required after acceptance into the program. This includes CPR certification, bacterial meningitis, negative TB skin test or similar, hepatitis B, MMR, Tdap, physical exam, health insurance, malpractice insurance. A common question currently is about the COVID-19 vaccine. Most of our affiliate hospitals do require some form of documentation, either when the vaccine was taken or if there is some sort of exemption. If there are questions regarding COVID-19 immunization, please contact the department so we can have that discussion. Approximate cost to the program ranges from $6,000 to $9,000 depending on what is required and immunizations, uniforms, etc. The first year does cost a little bit more because of books, instruments, uniforms, tuition, and fees. The instruments include stethoscope. Books bought in the first year typically are also utilized in the second year. The second year does include tuition fees, books, and exit exams, which cost approximately $2,500, with a total approximate cost of, again, $6,000 to $9,000. This program does qualify for financial aid. It is the responsibility of the student to be prepared. If you are eligible, now is the time to start asking questions of the financial aid office when it comes to being approved for financial aid. Additionally, because we are a workforce program, Workforce Solutions, which is outside of the college, does acknowledge respiratory care as a quote-unquote hot job and covers many expenses outside of financial aid. Also, veterans on Hazelwood and the GI Bill are eligible to use their benefits during this program. I want to thank you for joining me on this information session. I hope that you have been able to find the information needed about respiratory care as well as applying to the program here at Lone Star College-Kingwood. If you want questions about the profession or the program, I am more than happy to be your contact. I have my information found right here, my email address, as well as my phone number. For general questions about the application process, please feel free to contact our healthcare specialist at kc-respiratorycare@lonestar.edu, as well as their office number found right here in this information. Lastly, this QR code will take you right back to the department webpage. If you wanted to see more information and about things found during this information, this QR code will take you right back to our website. Again, thank you very much and have a great day.